Hi, my name's Professor Tom Wainwright, Professor in Orthopaedics at Bournemouth University and Research Physiotherapist at University Hospital Dorset NHS Foundation Trust. This short presentation is going to talk about the programme we've been running over the last 10 years called Cycling Against Hip Pain, or the CHAIN programme. It's a programme for patients with osteoarthritis of the hip who are seeking to understand how best to self-manage their condition through exercise and lifestyle changes so that they can better manage their pain, increase their function and hopefully avoid the need for future surgery, or even if surgery is indicated in the future, ensure that they have done all of the things non-surgically they should be doing before they reach that point. So before I talk about it, a bit of context about osteoarthritis. 33% of people aged 45 or over in the UK will seek treatment from their primary care practitioner or physios for arthritis. And almost half of people aged over 75 have sought some treatment for osteoarthritis. And about 60% of those affected are women and 40% are male. And if we talk about hip osteoarthritis, about 11% of adults aged over 45 in England have osteoarthritis of the hip. So it's a condition that will affect many of us, and if it's not ourselves personally, it will affect our nearest and dearest. So it's something worth knowing about. In terms of treatment, NICE, which is the National Institute for Clinical Excellence within the UK, looks at all the evidence for a range of different conditions and treatments. And when they looked at osteoarthritis, they've made these three core treatment principles that all patients presenting to healthcare practitioners with arthritis should get as a first line of treatment. The first thing is education, advice and access to information about the condition of arthritis. This is really important for arthritis because when something starts to hurt, often we can stop moving it and become less active. But with osteoarthritis, we know that keeping more active actually is the best thing that we can do in terms of reducing pain, maintaining function and maintaining strength around the joint. So the second core recommendation is advocating exercise. That's both local muscle strengthening around the joint that's affected, but also aerobic fitness training, so cardiovascular exercise to keep heart, lungs and general body conditioning to a high level. And for certain patients who are overweight, then weight loss strategies could also be indicated. Simply put, the less weight going through the joint, then the less force and the less pain that joint is going to be under. But that's not obviously for all patients. These NICE guidelines are backed up by international guidelines. These guidelines on this page are from ORSI, which is an international group looking at the best management of osteoarthritis. In a process where they asked experts from around the world, they advocated that everyone should receive those three core treatments of exercise, education and weight management where possible. And if this was done, they actually advised that some people may then go on to have drug therapy or injection therapy for their arthritis. But it's important to know that if you're a patient, we don't have a magic bullet or a magic tablet to help cure your arthritis. So doing those first line treatments is really important. In actual fact, these experts also concluded that very few people actually go on to need surgery relative to the number of patients who have the condition. However, when the disease does progress, we have successful operations such as hip replacement, which can be life-changing for people with end-stage arthritis and significant pain and disability. So these are the guidelines, and this is what the experts say. But what is actually happening within physiotherapy practice within the UK? Well, this was some years back, but we did a snapshot audit of physiotherapy practice for patients receiving treatment for hip osteoarthritis. We got responses from all around the country in the UK and found that there was a mix of different interventions used by physios. They use strengthening exercises, stretch, cardiovascular exercises, balance exercise, proprioceptive exercises. But actually there was a consensus that what we felt was that physiotherapy management varied widely across the whole country, both in terms of the number of treatments that patients received and the type of treatment they received. So with the CHAIN programme, we developed this around about 10 years ago now, myself and Professor Robert Middleton, who is a hip surgeon here in Bournemouth. And the CHAIN programme was really based around an idea of getting patients to understand that exercise can help their hip pain. And at that point it was a 6-week programme, but it's now been advanced to an 8-week programme. And it lasts for about an hour each week, and it's a group-based programme where for half an hour patients will be taken through a specialised static cycling programme, and then we'll also have half an hour of an education and advice session on a different topic related to osteoarthritis each week. Now, we've done a number of evaluations of this programme, and I'll share some of the results of that with you now. In our first evaluation of this, where we've first looked at this programme for over 120 patients, we found that 86% of patients at the end of the 6-week programme had improved their functional ability and their ability to complete activities of daily living. 83% of patients had increased their leg strength, 83% of participants had improved their walking speed, and 100% of patients would recommend the programme to their friends. What was interesting about this first cohort of patients that we put through the programme was that it benefited a whole wide range of patients. So it wasn't just fit, young, active patients who were used to exercising. What we actually found was for those patients who'd never been in a leisure centre or had multiple different conditions and other chronic illnesses and those on different medications, actually they made some of the biggest improvements. And in this case study that we reported in BMJ case reports, we give the example of one patient who had a number of different health conditions. And if I'm being honest, before we started running CHAIN, I wouldn't have thought he'd been able to have done the CHAIN programme. But we put him through the programme, ensuring safety at all aspects, and he benefited massively from the exercise and education. So we mustn't make and prejudge whether patients can undertake these things, because they can be capable of lots more than we may think. So we latterly then replicated our initial programme on some more patients, and this was another 167 patients, and we slightly tweaked the programme so that we allowed patients to be referred not just from local GPs in the physiotherapy department, but also from orthopaedic outpatient clinics where patients had gone for an opinion from a surgeon for their hip. Again, we replicated the results once again, so we found that patients improved their activities of daily living and function after the programme. They improved their strength and they improved their walking speed. So this was really important because some of the patients entering the programme on this second time were actually further down the line in terms of their arthritis pathway. So it showed it could still benefit patients who are entering the programme with quite severe arthritis of their hip. The next study we did was then to follow up at 5 years all of the patients that were on the initial cohort of CHAIN that we'd run some years before. And we sent them out a survey to ask how they continued to self-manage their arthritis after completing the course. 96% of participants reported that the intervention increased their ability to self-manage their hip pain, so that was a fantastic result. And at an average of 5 years, only 45% of participants had not returned to their GP for further treatment. And 57% of participants had avoided any need for any surgical intervention in that 5 years. And really interestingly, all of the participants after the programme said that they continued to be engaged in physical activity at least once a week, which is a really fantastic result. So the results of these initial studies led us to then start to design how we could do a randomised controlled trial. Now this is a trial where we evaluate the CHAIN intervention against standard physiotherapy care. And we sought some of our patients to give us advice on how we should design this study, and we did a series of public and patient involvement sessions so that they could advise us how we needed to design the research and whether the programme could be improved in any way. They advised us that it should move from 6 to 8 weeks. They advised us that we should change and tweak how we delivered some of the education sessions, and they also advised us on some elements of how we should run the clinical trial. We were very successful in getting some funding from the National Institute for Health Research, And we've just completed recruitment for this study now, which is fantastic, and we're just analysing the results. Now, this is a study of over 225 patients where we've randomly allocated them in either to receive the CHAIN programme or standard physiotherapy within the hospital. And the idea is to evaluate whether patients who go through the CHAIN programme fare any better when randomly allocated compared to standard treatment. As I said, the results are just being analysed now. We should have them in the new year, and I'm due to submit the final report for this study at the end of March to the National Institute for Health Research. So publications and results coming soon. We're looking at both clinical results and also the economic results to understand what's best for us to provide for patients in terms of our healthcare services, so that we can provide more treatment to more patients in the most effective manner. Thank you for listening, and thank you for your interest in the CHAIN programme. I'm happy to take any questions if you send them to my email address or access me via Twitter. Many thanks.